So a patient that has an absolute lack of direct hair will be a patient that has had, typically will be a patient that has undergone prior hair transplant or hair restoration scalp surgeries, which result in scars, inadequate coverage, and an incomplete look.
Strip scar can be made, and also the punch and dagger type punch excisions were done in the past. And then again, the punch and dagger type graft excisions, quite visible. That's the beard area we intend to drive some grafts from. The hair is of good quality in the abdomen. We're encouraged by that. As you can see, hair has been extracted or harvested from the legs and thighs. You can see the abdomen, the chest, a little bit from the chest, and the arms as well. We did extract some hair on the beard. About 10,000 grafts have transferred in the 9-day period. As you can see, the hairline has been redefined. This is using a combination of beard hair and chest hair mostly. This was accomplished on day 1. The angulation was basically, the pattern of angulation was dictated by the prevailing pre-existing hair, which is from the flap surgery. Not exactly what we would have planned for going into the surgery, but we had no choice but to try to make the best of the situation with what we have. In all, it looks quite fine thus far. The arm hair was used. It's not the least in terms of quality is arm hair, and most of it was applied in mid-scalp. However, this was mixed up with some abdominal hair as well as some beard hair. And this is the sides, you can see. And as of day 9, we have successfully touched on all the areas of thinning, including sites of scarification from old-styled punch extraction. Looking at the results of body hair transplantation, combination of body and beard hair, 6 months after transplantation of 10,000 units for hair purposes. It's the history of previous hair transplant procedures and other scalp hair restorative procedures, history of flap, and also a strip that was taken from the hairline that imparted a scar, and we want a scar on the hairline, as well as a lot of stippling on scalp, the result of antiquated, old-styled, Black and Decker type punch techniques. And the surgery was done 6 months ago, the idea being to create a more natural looking hairline. What do you think of your results?
Incredible, fantastic results. I was looking for improvement, but this was fantastic.
We're now focusing on the hairline. Most of the hair that was placed in the hairline came from the abdomen, some from the beard area as well. As you can see, there's a fine, subtle widow's peak that is there, and it's come out very well.
And that's the temporal. As you can see, the darker hairs, this is mostly chest hair, a bit of beard hair there as well.
And that's the top view. As you can see at present, you can hardly make out the punch excision scars that riddle the top of the head are beginning to slowly fade as the top begins to fill in with all body and beard hair. Body hair transplantations tends to start manifesting optimally at about the 9th month, and improvement can continue for up to 2 years. The work extended all the way to the crown, and as you can see, the crown also, which used to be essentially empty with scars, is beginning to fill in, and on closer view you can see the evolution of a whorl that we artificially created. The hair is all very fine hair growing out, evidently body hair, and the whorl is beginning to assume its character. It looks like a natural thinning crown at this point. We expect that at the 9 to 12 month mark, it will fill in even more. This is an extremely close-up view of the abdomen. As you can see, there is really no evidence of any surgery. In fact, a good part of the hair has grown back. So there is ample supply of body hair in the event of any future needs. This time around, we decided to wet the hair. So here is the hairline, wet, and the hair basically brushed back, slick. You can see the definition of the hairline. And this is a very good depiction of the kind of results we have achieved with this surgery, because the hair is all wetted. What do you think of your results?
Fantastic. It exceeded my expectation. I initially was looking for improvement, but this was the best I could have possibly imagined.
Excellent.